Good morning. This is Dr. Tina, Glam Dog Tina. Please, if you haven't subscribed to my channel, I urge you to do so that it will boost me to bring to you some of these educative information. Today, our focus is psychiatric mental health nurse practitioner exam review series. So it's going to be series, and today I'm going to talk to you about neuroanatomy. The brain is a very essential part of mental health. As we treat diabetes, hypertension, and all that as disease, mental health is also a disease. And so if you have a problem with the brain, then you won't be able to function as it's supposed to. So it's very essential to understand the parts of the brain and how it functions. So as a human being, our feelings, our thoughts, emotions, everything is seated or starts with the nervous system. The nervous system is divided into two parts, central nervous system and peripheral nervous system. The central nervous system consists of the spinal cord and the brain. And then the peripheral nervous system, it consists of somatic nervous system and autonomic nervous system. When you take the autonomic nervous system, it's further divided into sympathetic nervous system and parasympathetic. It's very essential to know as a PMHNP so that you'll be able to deal with this and treat appropriately. So the brain is divided into many parts, and some of the parts it's known as cerebrum is the largest part of the brain and is divided into two called right and left hemisphere. So most people are left because they cross in its function. So the most people are right-handed, and so the function is the left hemisphere. And so this is very essential to know and understand the parts of the brain. If you want to pass your PMH exam or if you want to be a very effective psychiatric mental health nurse practitioner to deliver high quality care to your patients, then you have to know these parts of the brain. I'm not going into detail with every part of the brain, but I'm just selecting the essential parts to know for the exams or to prepare you for the exams. So I'm going straight to cerebrum. So cerebrum, like I said, is the largest part of the brain, which is divided into the two parts. It's also further divided into lobes. These are the frontal lobes, parietal lobes, occipital lobes, temporal lobes. All these lobes have its functioning, and you have to know the function of each of them. That will help you to understand what problem your patient have. For instance, if a patient comes to you and is not able to smell, taste, or touch, then you know that there is a problem with a parietal lobe. The frontal lobe, if the person is not able to perform executive functions such as thinking, planning, having problems with short-term memory, then you know there's a problem with the frontal lobe aspect. And so these parts are very essential to note. Occipital lobe, if somebody comes in with a problem of vision, then you know that his occipital lobe is affected. So knowing these parts is very essential. So the lobes are divided into frontal, parietal, temporal, and occipital. The cerebrum also consists of two types of tissue, and this is known as the internal brain structure. It consists of the gray matter and white matter. So gray matter forms the surface of each cerebral hemisphere. It's also referred to as cerebral cortex. The gray matter is linked with processing and cognition. White matter is the deeper parts of the brain. So the white matter consists of glial cells and myelinated axons. The frontal lobe. So when you take the frontal lobe, which is colored in pink over here on the slide or red on the slide, Its function is for planning, problem solving, speech, voluntary movements, and emotions. So if you have a deformity or underlying conditions that affect the frontal lobe, then you are not going to be able to plan or use the calendar to do anything. You cannot solve problems. You cannot have effective speech. You cannot move. So voluntary movement, like you decide to move, it won't be possible. Emotions, all these, if your frontal lobe is affected, then you won't be able to function as it is. The temporal lobe is located on the side of the brain, this and that. So you can use this slide is very effective because it gives you the symbol to know what is going on. So when we say temporal lobe is the part of the brain on this side. And so the memory, that's the one functions of the temporal lobe, learning, language, and hearing. So if somebody have a problem with learning or not able to speak the language, not able to hear, then we know that this patient has a problem with temporal lobe. Brainstem is very important, very essential parts of the body, of the brain. So because it does have a very effective function that one needs to have to be able to go about your duties every day. And so if you have a deformity or a problem with this part of the brain, you won't be able to do involuntary movements, breathing, heartbeat, digestion. So it's very critical if you have a problem with the brain stem because your digestive system won't be able to function appropriately, and so it's very dangerous and the person can die. Your heart rate is affected or heartbeat is affected, and so you are not able to breathe on your own and all that. Breathing becomes difficulty aspect for you because you can't breathe on your own. So this is a very essential part of the brain that when you have a problem with it, then it's going to be critical because you won't be able to do anything. You won't be able to search, you won't be able to breathe on your own, you won't be able to have the heartbeats as demanded, you won't be able to have a adequate or the functioning of the digestive system. So it's very critical parts of the brain that we need to know. And this is the brainstem, that's the lower part. Cerebellum is part of the brainstem, and its function is fine movement, balance, and coordination. So over here, we use the Rombeck test to see if you have a balance. Parietal. Parietal lobe is usually at the top of your head, and it's for sensory. That's where you use to read and write. So if you have issues with the parietal lobe, you won't be able to read, you won't be able to write. And so to remember this, I know that as I was going through studies, people were linking this with parent. You know, you won't be able to do anything. Your parents have to help you with reading. Your parents have to help you with writing. So parietal lobe is a place for sensation. And if you lose this ability, you won't be able to read or write. They won't be able to sit quietly to focus and study and read. And this part is very essential. So occipital lobe. Occipital lobe is the for vision and also color perception. So if you have any deformity in this part of the brain, vision becomes a problem. You can lose your eyesight. Also, you won't be able to have color perception or you won't be able to differentiate colors. And so that is why they do colorblind and all that to see if you have a problem with that. So it's very essential to know this part of the brain as well. Our references, I took most of these pictures from Google imaging. So its source of reference is unknown, and also based this teaching on the PMH, or the Psychiatric Mental Health Nurse Practitioner, the 4th edition. Um, Also, I read them. I didn't take them specifically out of there, but I have read this book multiple times. So I'm trying to make sure that everything I'm going to put out there are very effective to pass your exams and not to just ramble anything on this channel. So if you like this series I'm doing, just give me a thumbs up and subscribe to my channel. And I wish you good luck, and I pray that everything I taught over here will stick in your brains. Just memorize everything according to the pictures I presented, and that will help you retain information. All right. Again, this is Dr. Tina, Glam Doc Tina. So make sure you subscribe. Thank you. Have a good day.